to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Carmen, and on today's episode, I have with me as my guest, Anna Hollinsworth. She is the Director of Henry County Home Health and Hospice. Welcome to the show, Anna.
Thanks, Kara, for having me today. Happy to be here.
Great, yes. So, Anna, as the Director of Henry County Home Health and Hospice, and, the fact that West Tennessee Healthcare just recently acquired, it started the presence there in Henry County. I wanted to start at the beginning with, what led you into healthcare and how did you find your way into home health and hospice?
Well, honestly, I have always wanted to be a nurse, probably ever since I was 5 years old. That's all I wanted to do. I did start my career in the hospital setting, but as my babies came along, I just wanted a career that was more flexible with my schedule.
Sure, yeah.
So I interviewed with Home Health, and here we are 12 years later.
Okay, 12 years. Wow. So for those who might not be familiar, can you give us a quick overview of what home health and hospice services actually looks like day to day?
So we provide care in our patients' homes. Our nurses and therapists and social workers, they travel from house to house all day long. We might be in one home anywhere from 30 minutes to an hour. We take care of the patient and then we go to our next. And we just stay as long as they need us in that particular moment.
Great, yeah. So what's something that people might think they know about hospice care that's actually a big misconception?
Well, I know personally, I always felt like hospice was a big no-no. There's a stereotype around hospice. I always felt like these people just keep them sedated until they pass away, but I have learned that is completely false.
Right.
We are there to bring comfort to the patients, their family members. We bring support and dignity. We help fulfill end-of-life wishes. Our agency even has a hospice foundation, and recently we helped one of our patients knock something off their bucket list, and we helped them go to Legoland.
Oh, nice.
So it's just very neat, just a very rewarding career.
Right, yes. And I mean, it encompasses so many more things than I guess, the average person would think about, not knowing what it is like, in a day-to-day. And seeing that it is such an important team, what does a typical day look like for you as the director?
Well, I wear many hats. I'm still a nurse, so if I need to get my feet wet and get back out and help and see patients, I'm there. I do anything from filtering phone calls to doing billing and financials to welcoming Joint Commission in the door when they come for state surveys. We have lots of meetings and education and planning. So just whatever needs to be done, that's what I do during the day.
Right, yeah. And, with hospice being such a deep personal situation for people, that this isn't something that a lot of people, would even have the capability to do. So how do you balance the clinical side of care with the emotional and personal support that families often need during hospice?
So I actually have a quote. I talked to our hospice supervisor, Denise Brogdon. She's been a nurse for 17 years. She said the two most important days of your life are the day you were born and the day you find out why. So hospice is definitely a calling. It's a field where you have to be filled up in order to pour out to others.
Right.
But experience, you can't replace experience. You can't train experience, but that's honestly what offers the most support for our families during this time, and listening, being confident about your decisions, and providing guidance when needed.
Right, yeah. Do you have a moment or a story from your time in this role that's really stuck with you? I know that's kind of like how you said, it's kind of the things that make you say, this is why I do this.
So we actually lost one of our own. One of our nurses passed away recently, and we did what we call the nurse's final farewell. And that was probably the most rewarding experience of my entire nursing career. But Tracy's family invited us to do this ceremony at her funeral, and we just all rallied around each other. It was very difficult, but as a hospice nurse participating in that, it was just an experience that I never thought I would have. But she's still with us. I even have her desk, and we think about her often.
Okay, great. Yeah. So how does your team work with the local community here in Henry County to ensure people know that these services are available?
So we do have some liaisons that promote us, and they do some marketing, and they go out. We speak at the community center, the senior citizen center. We have a presence in the assisted living facilities here and the skilled nursing facilities here. But honestly, what gets us in the community more than anything is word of mouth. When you can take care of a patient or their family member, everybody's going to hear about it at church. Everybody's going
Yeah.
to hear about it in the grocery store, whether it's good or bad. But honestly, that's what pushes us out more than anything.
Sure, yeah. So have you seen any shifts in how the families in West Tennessee view home-based care over the years?
Well, it is an alternative. Instead of going to the hospital or a nursing home for long-term care, why not let us take care of them in their home? So I
Right.
do feel like people come around to that because it is in the comfort of their own home.
Right, yeah. And like the roles that volunteers play in hospice, the fact that, a person doesn't I can imagine for a family not wanting to have to make that decision that hospice helps with that. So what role do volunteers play in hospice, and how can people get involved if they're interested?
So volunteers are very important. It's really neat. Some people might come and do music therapy or pet therapy or play games. They may just be there to be a companion or run errands, but it does allow that caregiver a chance to get out. So if anyone is ever interested in becoming a volunteer, they can call us at our office at 731-642-7600, and they can ask for Carmen. She is our volunteer coordinator, but we welcome any and all volunteers.
Great, yes. And I will make sure that I get that phone number added to the show notes of this episode so people can check that as well to have that information. So are there any challenges that your team faces today, whether, staffing, awareness, or something else? You a little bit touched on it, with Henry County being such a rural community.
So yeah, staffing is an issue anywhere in healthcare. I guess for me and our team though, as busy as we get, I never want to lose our family feel
Right.
because we're just neighbors taking care of neighbors. Life is busy, but we never want to be too busy for our patients or their families.
Exactly right. So, with the advancement of technology throughout healthcare, over the years, has technology changed the way home health or hospice care is delivered in recent years, or are there any tools or systems that have made a real difference for you?
So we're no longer on paper. Everything is electronic now.
Digital.
We have tablets we take in the homes. We can pull everything up at our fingertips. It does help improve communication with the doctors. We do have our tablets work off of cell phone towers. There is capability for telehealth, especially during the
Okay.
pandemic. That came in handy.
Right.
But there's so much that technology has improved to help us meet our Joint Commission standards for Medicare as well.
Right. Yeah. And that's, having that at your fingertips and all that information, not having to drag papers all around. I can imagine that that's a big way to streamline it.
Absolutely.
Are there any new programs or initiatives you're particularly excited about right now?
So, one thing I get excited about is we provide both home health and hospice. So, with our
Right.
home health side, we have some physical therapists that have special licenses. So, our PT, we have one that's licensed in vestibular therapy. We have another one that's licensed in lymphedema therapy and dry needling.
Oh, okay.
Something I think that helps us stand out is we can still offer CNA services for home health. A lot of the home health agencies don't offer that anymore. And then with hospice, we have a veterans program. Our veterans,
Okay.
their
Yeah.
families receive a flag. Our hospice, we can also use PCA pumps. Our hospital helps set that up, and it's just a way that helps us stand out and
Great.
apart from other hospice agencies.
Okay, great. Yeah, that definitely makes a difference. Now, when you said CNA, is that certified nursing assistant? For those of us
Yes.
who are, I was like, CNA, I've heard that term. Just wanted to clarify that. So, with this field, it's kind of a heavier side of the healthcare industry. What keeps you motivated in a field that can be emotionally intense?
So I think at the end of the day, we can never forget why we became a nurse and that we are
Right.
nurses and healthcare providers. And so really, it is just taking care of our patients. I And I know that each one of my clinicians truly cares about our patients. I think it's really neat that we get to work for a nonprofit company. We're not corporate. And so it's not just a business.
Right.
It is truly caring for our patients.
Right, yes. And I know you touched on this a little bit before about, not having to pour from an empty cup. How do you take care of your own well-being while leading such a compassionate, demanding team?
So, outside of work, I do work on self-care,
Right.
just making sure that I can leave any issues I have at home at the door. So when I come in, I'm ready to support my team. I like to practice what we call servant leadership. I want to make everyone else's job easier so they can spend as much time as they can in the home with
Right.
who really needs it.
Great. Yeah, that's really great. And especially, you have to be able to take care of yourself in order to take care of others. I know that's a big thing that a lot of people struggle with. So if you
Well,
could,
sometimes we become last on that.
yes, and it's kind of counterintuitive because you think, I got to give to others, but you matter too as the individual.
Absolutely.
So if you could tell every family in West Tennessee one thing about the value of home health and hospice care, what would that be?
I would say give us a try. If you're not familiar with these services, ask questions. Let us help you and don't get burnt out. And, for a lot of people, I think they have a hard time taking others up on help,
Right.
especially in this society. But take us up on the help and see what services you could receive and just give us a try.
Right, especially if, you have a full-time job or you have your own things going on, that taking care of a loved one, just adds so much more weight to it that, this is what you guys are here for.
It's very stressful, and there's no manual to navigate this
Right.
time in your life when you're caring for your parents or an elderly family member or even a spouse. So we have social services that can help navigate this difficult time and get some things set up to make your life easier.
Right. And, just having that resource is so important. So I know you mentioned the volunteer information. Is there a different number, or where can people go if they want to learn more, refer a loved one, or even join your team?
So our website currently is hcmc-tn.org. Soon we'll be all meshed with one on the WTH.org. They can come by our office. We're located at 221 Tyson Avenue here in Paris. We do cover 6 counties, so we're not limited just to Henry County.
Okay.
We also cover Benton County, Weakley County, Carroll County, Stewart, Humphreys, as well as Henry. So our branch is located here in Paris, and yes, it's that same phone number, that 731-642-7600.
Great. Well, is there anything I didn't ask that you really want to get out there?
So just a couple things. Just a reminder, home health and hospice, they're both a benefit that's offered under Medicare. So if you have Medicare, it is completely covered. There's no copays, there's no deductibles. And then we also take most private insurances. Home health offers services such as skilled nursing, physical therapy, occupational therapy, speech therapy, and those home health aides. And then, of course, with hospice, we have nurses, social work, CNAs, chaplain, and volunteers. And we are very blessed with a very involved medical director. Her name's Dr. Stephanie Dunnigan. She is wonderful. And then we also, both home health and hospice, we have a nurse on call 24/7.
Okay.
She's local, and she can help get you the help you need when you need it.
Right, yeah. And all the things you just said, it's like, I don't think people realize that it really does encompass, so many different facets of healthcare. And they may not know that, it could be covered by their insurance. So yeah, definitely just giving you guys a call and checking, there's no harm there.
We would be happy to answer any questions.
Right. Well, Anna, thank you so much for coming on and sharing everything about home health and hospice up there in Henry County. And the fact that you guys don't just serve that county, you serve the surrounding areas. And, just giving people a little bit more information about this sector of healthcare that, many people don't know much about. We are very grateful that you came on and shared a lot of this great information with us.
Absolutely, Kara. You have a great day, and thanks for having me on your show.
Thank you so much. You too. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.